Whether you are a physician, a practice manager, a leader of a physician group, or in the business of delivering medical services, you have lease agreements in place at one or more facilities. The monthly cost of these leases add up and make up a significant portion of your business operating expenses. With the decline of medical reimbursements continuing, paying close attention to the details of one's lease has become more important than ever as a factor of your bottom line. Medical office leases typically contain terms that are advantageous to the landlord and not to you as the user of the space. As a busy professional, you may not be aware of market conditions that affect issues such as your rental rate, the length of your lease, annual rent increases, and the ability of a landlord to bill you back after the fact for operating expenses. In fact, many leases have no limit on the amount that can be charged back to you, including a management fee paid to a third party, or sometimes paid to the landlord itself. What is the market rate? Should I accept annual increases in rent? Do I need to personally guarantee the lease? What amount of build-out should I get? Can I get more? Why do I pay for part of the common areas? Is the landlord giving rental concessions that I should know about and also be receiving? All these are questions that we can answer at no cost to you, so that you become an informed consumer of medical space. Just like when a patient needs a medical specialist, healthcare companies need a healthcare real estate specialist. Tom Brosseau, Senior Vice President and Principal, has almost 2 decades of healthcare leasing, development, and brokerage experience. Ruth Davis earned the MAI designation and has specialized in healthcare valuation, consultation, and brokerage over the past 10 years. Many healthcare organizations have turned to Tom and Ruth as their advocates to get better lease terms, more money for their buildings, or to have a new building developed. Tom and Ruth only represent tenants, and their services are provided at no cost since the landlord pays their brokerage fee. They obtain the best monetary and non-monetary lease terms for their clients and have negotiated literally thousands of medical leases. For example, a Nashville client imaging center saved more than $500,000 hard dollars over a 10-year lease period. This service was provided at no cost to the client. Tom and Ruth are Swearingen Realty Group's healthcare experts. With an advantageous office location in Dallas, Texas, Tom and Ruth represent clients nationwide with one point of contact for all real estate services. A team of 11 researchers support Tom and Ruth with market surveys that are prepared for clients across the United States. In addition to complimentary market studies and consultation, Tom and Ruth's clients have access to a very unique lease management service provided by their in-house team of professional lease administrators. If your company has several leases, or 700, the terms of these documents need to be managed. Swearingen Realty Group currently manages over 6,000 leases for 50 companies on its web-based proprietary lease management software. Swearingen employs 4 full-time lease administrators who scan in copies of leases and construction documents, create lease summaries, and email prompts for critical dates, such as renewal option tracking. Available 24/7 on Swearingen secure servers, Tom and Ruth's clients have access to lease information from anywhere in the world. This powerful and intuitive lease administrative database service is provided for a nominal fee when Tom and Ruth represent you in your other real estate transactions. Talk to Tom and Ruth about representing you at no cost to you. Their databases, research, and extensive experience result in effective negotiation of the best rates and terms for each lease. Whether you are interested in a new location or even just have a renewal coming up, Tom and Ruth will save you money while working with your current landlord or a new one. In addition, if you are deciding whether to monetize an existing building, they can value your asset and sell it for the highest price. Contact Tom and Ruth today to take control of your healthcare real estate needs.